Atrial fibrillation, commonly known as Afib, is the most common type of irregular heart rhythm, affecting millions of people worldwide. It can significantly increase the risk of stroke, heart failure, and other cardiovascular complications. Understanding this condition, its diagnosis, and how to manage it effectively can make a huge difference in the patient's quality of life and long-term health outcomes. Hi, I'm Dr. Knapp, family medicine physician, here to bring you medical information so you can take control of your health and make the most of your doctor visits. Let's get started. Atrial fibrillation is a disorder of the heart's electrical system that causes an irregular and often rapid heartbeat. In a normal heart, electrical signals travel in a coordinated manner from the sinoatrial node, the heart's natural pacemaker, through the atria and ventricles, causing them to contract in a synchronized way. However, in Afib, these signals become chaotic, leading to uncoordinated and ineffective contractions of the atria. This irregularity can cause the heart to beat too fast, too slow, or at an unpredictable pace. Afib can be classified into different types based on its duration. Paroxysmal Afib is intermittent and can last from a few minutes to several days before returning to a normal rhythm. Persistent Afib lasts longer and usually requires medical intervention to restore normal rhythm. Long-standing persistent Afib continues for over a year, and permanent Afib is when the heart remains in this irregular rhythm indefinitely, often due to the failure of previous treatments or a decision to accept it as a long-term condition. Symptoms of Afib vary from person to person. Some individuals experience no symptoms at all, while others may have noticeable palpitations, which feel like a fluttering or racing heartbeat. Other common symptoms include fatigue, shortness of breath, dizziness, chest discomfort, and reduced ability to exercise. In some cases, Afib may only be detected during a routine medical checkup or when complications arise, such as stroke. The irregular heartbeat in Afib can cause blood to pool in the atria, leading to the formation of clots. If a clot travels to the brain, it can block an artery and result in stroke. This is why individuals with Afib have a significantly higher risk of stroke compared to those with normal heart rhythms. Several factors can contribute to the development of Afib. Age is one of the most significant risk factors, as the likelihood of developing Afib increases with age. High blood pressure is another major contributor because it can cause changes in the heart's structure over time, making it more susceptible to arrhythmias. Heart diseases such as coronary artery disease, heart failure, or valvular heart disease also increase the risk of Afib. Other contributing factors include excessive alcohol consumption, obesity, diabetes, sleep apnea, and hyperthyroidism. In some cases, Afib can occur without any underlying condition, in a situation known as lone atrial fibrillation. Genetics may also play a role, as some people have a family history of Afib, suggesting a hereditary component. Diagnosing Afib requires a combination of patient history, physical examination, and diagnostic tests. A doctor will ask about symptoms, lifestyle factors, and medical history to assess potential risk factors. During a physical exam, an irregular heartbeat may be detected by checking the pulse or listening to the heart with a stethoscope. The primary test used to confirm Afib is an electrocardiogram, or EKG, which records the heart's electrical activity. If Afib is intermittent and not detected during a standard EKG, other monitoring methods may be used. For instance, a Holter monitor or Zeo patch is a portable EKG device worn for several days, allowing continuous monitoring of heart rhythm. Additional tests may be performed to identify underlying causes or assess the heart's overall health. An echocardiogram uses ultrasound waves to visualize the heart structure and function, helping to detect problems like valve disease or heart chamber enlargement. Blood tests may be ordered to check for thyroid function, electrolyte imbalances, or other conditions that can contribute to Afib. In some cases, a stress test or a cardiac MRI may be recommended for further evaluation. Managing Afib aims to control the heart rate, restore normal rhythm if possible, prevent complications such as stroke, and address underlying causes. Treatment plans vary based on the severity of the symptoms, the duration of Afib, and the patient's overall health. One key aspect of Afib management is rate control. This approach focuses on slowing the heart rate to improve symptoms and prevent excessive strain on the heart. Medications such as beta blockers, calcium channel blockers, or digoxin are commonly prescribed to achieve this. Another approach is rhythm control, which aims to restore and maintain a normal heart rhythm. This can be done with medications known as antiarrhythmics such as amiodarone, flecainide, or sotalol. If medications are not effective, procedures such as electrical cardioversion may be used. This involves delivering a controlled electrical shock to the heart to reset its rhythm. For some patients, catheter ablation is an option. This procedure uses radiofrequency energy or cryotherapy to destroy abnormal heart tissue responsible for the irregular rhythm. It is typically recommended for those who have not responded well to medications or have persistent symptoms. One of the most important aspects of Afib management is stroke prevention. Blood clots that form in the heart can travel to the brain and cause a stroke, so anticoagulant medications are often prescribed. These include warfarin or newer anticoagulants such as apixaban, rivaroxaban, and dabigatran. The choice of anticoagulation therapy depends on the patient's individual stroke risk, which is assessed using a scoring system like the CHA2DS2-VASc score. I just want to take a moment to ask that you hit that like button and subscribe to my channel. Leave a comment below if you have any questions or topics you want covered in future videos. Anyway, lifestyle modifications are also crucial in managing Afib. Maintaining a healthy weight, reducing alcohol intake, avoiding excessive caffeine, and managing stress can help reduce episodes of Afib. Regular exercise is encouraged, but it should be done under medical supervision, especially for those with significant heart conditions. Treating underlying conditions such as high blood pressure, diabetes, or sleep apnea can also improve Afib control and reduce complications. For some patients, Afib is a chronic condition that requires long-term management. Periodic follow-ups with your doctor are necessary to monitor heart function, medication effectiveness, and potential side effects. Adjustments to treatment may be needed over time to optimize control of the condition. In some cases, Afib may resolve with treatment of the underlying cause, such as hyperthyroidism or an acute illness. However, for many individuals, it is a lifelong condition that requires careful management to prevent complications and maintain a good quality of life. It is important to seek medical attention if symptoms of Afib develop, especially if there is chest pain, severe dizziness, fainting, or difficulty breathing. These could indicate a serious complication requiring immediate intervention. Even for those with a known diagnosis of Afib, any worsening of symptoms should be discussed with a healthcare provider. Atrial fibrillation is a common but serious condition that requires proper diagnosis and management to reduce the risk of complications. By understanding the causes, symptoms, and treatment options, individuals with Afib can take an active role in their health. With the right combination of medication, lifestyle changes, and medical procedures, when necessary, many people with Afib can live full and healthy lives. If you or a loved one have concerns about Afib, consulting a healthcare professional is the best step toward effective management and long-term heart health. Thank you for watching. As always, take care of yourself and make the most of your day.